and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Terrebonne Home Care. Very glad you are joining us. However you may be joining us, we appreciate it. And, you know, it's always good to turn to our specialists, especially in this time where we're kind of dealing with and still trying to make sense of a lot of these infectious diseases. We're very glad to have with us Dr. Eric Brooks, Medical Director of Region 3 of the Office of Public Health. Welcome and thanks for joining us.
Thank you.
All right, we appreciate you being here. You know, one of those things that people keep talking, infectious disease is one of those things that I think people sometimes get a little confused about what it is or what it means, but nobody's confused about what COVID and monkeypox have been. So let's talk a little bit about that and kind of what we're dealing with now.
All right. We can start with COVID. And good news about COVID is right now the numbers are significantly down compared to our most recent spike and our previous spikes. Yeah. Also, kind of new, you might have seen this in other news, the mRNA vaccines have now released a bivalent version, and kind of what that means is that they cover not only the original strain, but the currently circulating strains.
Oh, that's awesome.
Over 90% of that is a subvariant of Omicron, BA4 and BA5.
Okay. And so it will be able to cover that. It will help protect you, if you will. And it's, again, it's not going to prevent you from getting COVID, but it's certainly going to prevent you from getting very sick from COVID is the goal.
Absolutely. Okay. And with the new bivalent being more specifically designed for the currently circulating variant, it's going to do that much better job at that. Wow,
much more efficiently. Very good. That's awesome. And so they're mixing those boosters now. Can you talk a little bit about that?
So the booster is available to anyone with a completed primary series.
Okay.
So the bivalent bivalent vaccine is not available to get as a primary series. You still need the original for the primary series.
Okay.
And there needs to be at least 2 months in between your last COVID shot and getting the new bivalent booster. Okay. So if you had a booster last month or a week ago, you need to wait.
All right. So get that 8 weeks in before you can go do that. Okay. Very good. And so just a little bit more about how that's, what's approved for what age groups?
Yes, sir. So Moderna, both of these are the mRNA vaccines. So Moderna is going to be 18 years and older, and Pfizer is approved for 12 years and older.
Okay. And have y'all seen a lot of those vaccinations for both age ranges?
Yes, absolutely.
Yeah. Okay, very good. That's exciting. Well, I know we've been talking about that. Earl Hughes kind of comes on and talks about where we are with our numbers. We're certainly hoping to kind of continue to increase that. Even though, like you said, those numbers are down, significantly down, we still want to kind of increase that.
Absolutely.
Our
absolutely.
Vaccination rates. Anything additionally with COVID?
I think it's important to note, too, and we can talk about the flu some more, but it is coming up to flu season. You can get the COVID booster and your flu shot at the same time. You may experience more side effects if you have those both at the same time, but they are safe to get at the same time.
Safe to get at the same time. Very good. Now, listen, I think one of the things that people are a little bit less aware of and a little bit not educated as much on is monkeypox. Tell us a little bit about what this monkeypox is and how we can deal with it.
So monkeypox is very closely related to smallpox,
right.
Much less severe. But the good news in that being related so closely to smallpox is that the vaccines and the treatments that were developed for smallpox are also effective against monkeypox.
Okay.
And we did a fairly good job, I think, at getting ahead of monkeypox as it started to emerge in Louisiana, kind of taking notes from overseas and places like New York. And we've actually seen cases kind of plateau in Louisiana recently.
All right. And those numbers are around 240 or so?
They're around 240 as of yesterday.
Okay. And so, again, we've been hearing that it's a little more concentrated in some of the higher populated areas, and we're seeing that in Louisiana as well.
That's very correct. So 70% or more of the cases have been in the New Orleans area.
Okay.
Very small percentage has have been in the Bayou River parishes, Baton Rouge area, Lafayette area, but we are neighboring to them, so we're at higher risk.
Okay. Have we seen much in Region 3?
Not much. So far, there's only been about 15 documented cases in Region 3.
Okay, which is the area,
The Bayou
of course,
River parishes.
the Bayou River. Okay.
Yes, sir.
Yeah, I didn't know if those cross over as the same. I always hear it as Region 3. So my
Gotcha.
buddy Tim Butler, that was one of his things. Region 3 kind of got drilled into me over the years. And so the Bayou region, as they do that. And so people can actually get vaccinations for those as well. And we're going to talk about the vaccinations. But have they been efficient with the vaccinations
Very.
for that? Oh, wow. Good.
Even after exposure, a vaccine for monkeypox can be effective, if not preventing the disease altogether, significantly reducing the severity of that disease.
Okay. And not that we want to be too specific about whom this affects, but there's a unique culture that kind of normally has this,
so
right?
It's very prevalent in certain groups.
Okay.
Mainly what we're seeing is gay, bisexual men, those engaged in high-risk sexual behavior, such as having multiple partners, people who have engaged in intravenous drug use,
Okay.
and others that, such as medical personnel or hospitality personnel that may be cleaning bed sheets and hotels, things like that. Those people all may be at risk.
Okay.
And they're qualified to receive a vaccine. In order to encourage people to get vaccinated who feel like they may be at risk, we're not asking them to identify that risk.
Okay. Be remiss if we didn't mention that flu season's coming up, as you kind of alluded to in the first segment.
Yeah, and the important thing to remember about the flu is it's best to be vaccinated before flu season begins. We really ask people to be vaccinated before the end of October.
Okay,
Really best
so
time.
before Halloween. Get it in before Halloween.
Yes, sir.
Okay. And so what are we looking at with the flu this year? We talk about it all the time. I know we talk about kind of the strains of A and B of the flu. And so any projections, anything that your office has kind of been looking at for what our anticipation is?
Well, it's difficult to anticipate really the peak of the flu. Usually it peaks between December to March. And so it's really difficult to predict that. That's why we ask people to get vaccinated earlier. As far as the strains, there's a quadrivalent vaccine that's being given this year, and that's designed to prevent what they predict is going to be the most prevalent strain for the season.
Oh, fantastic. I got to tell you, just talking and thinking about these things, it makes me realize that, and I don't know if it's because of COVID or not, but we seem to be much more efficient in our development and the coverage of vaccines here in the last 3 to 5 years.
Certainly hope so.
Yeah, yeah.
We'll
That's the
see
goal, right?
We'll see how the numbers play out. We're definitely going to keep a close eye on that.
Okay. And while we're in this transition, the fall time, and you know, I know we see it very often in the summer, but boy, we've still got a lot of these mosquitoes hanging around. Can't get rid of them, kind of like we were talking off the air. Let's talk a little bit about these mosquito-borne illnesses that I think sometimes takes a back seat to some of these other issues.
Yeah, and thankfully, over the last few years, we've gotten a little bit of a reprieve. But this year, we've seen a spike in mosquito-borne illnesses. Mainly want to talk about something called West Nile.
Right.
Because we've seen a spike in it this year, not that it's the only mosquito-borne illness. There's others such as Zika and dengue, just to mention a couple.
Right.
But the West Nile virus, mainly being spread by mosquitoes, it's asymptomatic a lot of the time, meaning it doesn't really cause problems. But about 20% of the time, it's going to cause a flu-like illness. Fevers, chills, muscle aches, that sort of thing, and somebody will recover. But about 1% of the time, so about 1 out of every 100 people will develop something called NID, or neuroinvasive disease, which can be fatal.
Right.
We've actually seen several fatal cases in Louisiana this year.
Wow. And that doesn't mean because we have more mosquitoes, but that's still that 1 in 100 chance that this could become a very difficult, even a fatal disease. And so 20% of those people develop some flu-like symptoms, and 1% can actually die from this. So we just need to be careful.
Yes, sir.
Make sure that we're spraying, make sure that we're trying to keep mosquitoes away from our humans and our pets.
Yes. Good to make sure that you're eliminating standing water. Containers that can accumulate standing water around your home too is a good way to prevent mosquitoes.
Right, especially with the volume of rain we get at one time. Just don't have anything sitting around your house that can hold water.
Correct.
Want to get rid of that.
Yes, sir.
And so we have seen some pretty high rates of that in Louisiana, especially, right?
Yep. Louisiana is the 4th highest rate of West Nile neuroinvasive disease right now. It is high this year, but it's not the highest that it's ever been.
Okay.
We've gotten, like I said, we've gotten a little bit of reprieve over the last few years, but back in 2018 season, we had approximately the same numbers that we do now. So kind of during the COVID pandemic, we had a little bit of reprieve. We got that, but it's back, and we need to start paying attention to it.
Yeah, and now that people are outside more, people are going to festivals more. I mean, a lot of those things, we put ourselves in that percentage of being outside a whole lot more, and the potential for getting those things.
Yes,
people
sir.
are out camping again, and some of those things. A lot of times we want to do that around water. It's just kind of the natural flow of that. And so there's been more NID cases as well, right? That we've seen overall.
Yes, so there have, and like I said, there's been a total of 5 fatal cases in Louisiana. There's been 2 or 3 cases here in the Bayou River parishes.
Wow.
So it's out there.
Okay. Wow. Very, very interesting. So, again, protective measures are making sure mosquito repellents when you're outside. Try and find a way not to get bit by mosquitoes. I mean,
That's
it should be something we practice in this region anyway, right? And again, that's standing water like you talked about. And so of all those that we've talked about, it's important for us to know that, and we'll just kind of start talking about this before this next segment, about vaccination options.
Yes, sir. And so a yearly thing that we do, coming up, we have what's called an MVE, or a mass vaccination event. Now, that's going to be held in Thibodaux on October 27th, from 1:30 to 6:30 p.m. At the Warren Harang Municipal Auditorium. At that event, we are offering flu, COVID, and monkeypox vaccinations. Everybody is encouraged to go. We will have drive-up services and walk-in services.
Oh, wow. That's exciting. To be able to have both of those
Yes,
options for people. If they don't want to get out of the car, they don't have to. People want to get out and kind of walk around, they can. But it's offering all 3 of those.
Yes,
Flu
sir.
season's coming up, like you said. One of those things, December through March or so is kind of the big time that we see the flu. We want to go and get protected from that. Always need our COVID protection.
Yes, sir.
And now with monkeypox being more prevalent in Louisiana, so it's an option. So again, that's in Thibodaux at the Warren J. Harang Junior Municipal Auditorium, October 27th. It's from 1:30 to 6:30. That's a long time. 5 hours that people have to go and do that.
Yes, sir.
And talking a little bit about this MVE, this mass vaccination event in Thibodaux, we encourage people to come out, but even if they don't have the ability to pay, we still want them to come, right?
Correct. We ask them to bring their insurance card if they have insurance, but the vaccinations are not dependent on their ability to pay.
I love it. And so it's one way that we can kind of really include everybody that needs that, and it doesn't really exclude anyone. And so I know that there's a lot of things going on. We're talking about what's happening in Thibodaux, but boy, we got some stuff happening here in our own backyard as well. So let's talk about the other vaccination event that we have going on over at Terrebonne Health Unit.
Yes, sir. So we have a vaccination event as part of National Preparedness Month. We have an event called We Prepare. So there's a vaccination event at the Terrebonne Parish Health Unit this Friday on the 23rd from 8 a.m. to 5:30 p.m. Again, we will be offering COVID vaccines, flu vaccines, and monkeypox vaccines. Again, those COVID, we have the primary boosters available and the bivalent boosters available.
Oh, wow. Fantastic. So even if it's your first booster, you can do that as well.
Yes, sir.
Okay, very cool. And so free COVID test kits as well.
Yes, sir.
Because I know, as you mentioned, we're talking about all of these different infectious diseases. But let's say that we're out and about, we're having fun, we're out, we get bit by a mosquito, we don't know what the issue is, but we start with some chills and fever. We should probably take a COVID test just to make sure, right, of what it is or what it isn't.
Any cold or flu symptoms, you should always take a COVID test, and we will have those available for people at the health unit this Friday.
I love it. Y'all also going to provide some education. It's one of the things that I know that Terrebonne Health Unit has always done is provide excellent information about and education. Let's talk a little bit about some of the stuff that will be out there.
So we'll have educational materials available on some of the diseases we talked about, monkeypox, West Nile, mosquito-borne illnesses, but we'll also have things regarding some of the current health issues like opiates, emergency preparedness. It is hurricane season, and the services that we offer at the health unit. I'm surprised at the amount of questions I get on where can somebody get tested for HIV, things like that. We do offer those services at our health unit, and so we'll have all that information available for people on Friday.
Fantastic. And it's really interesting where I think health meets mental health, and I love that we have this option. People are always a whole lot more understanding and accepting of what a health issue is, but boy, we've got a long way to go with helping people understand that mental health diagnoses are just like any health diagnoses. And y'all are trying to do something about that, right? Tell us about Shatter the Silence.
Yes, sir. And I have to give credit here to Christy Howard, our Terrebonne social worker, Terrebonne Parish Health Unit social worker. She's organized an event called Shatter the Silence, Hope Heals, and that's going to be held November 5th from 12 to 4 at the Dumas Auditorium.
Right.
And this is open to the public. This is a community event, and the purpose is to increase awareness, especially of the increasing rate of suicide amongst African American youth.
Right.
There will be a panel of professionals from different sectors who will be available to provide education, answer questions. There'll be some presentations, and we're going to share resources that are available here within the region and the area to people who may be suffering from mental illness.
Right, and we just want to try and recognize it. We want to make sure that people know what the warning signs are, and that's what that panel is going to be able to help us do.
Yes, sir.
The other thing that's really exciting about this for me is there's a faster way to get through with the suicide hotline, right?
There is. There used to be a 10-digit phone number that, to be honest, I could never remember.
Right.
Now, if you can remember 911, you can remember 988. That's the new number since the summer that has really been pushed out by the Louisiana Department of Health. That's your new mental health crisis line, and they'll be able to connect you to the appropriate resources and kind of walk you through any kind of mental health crisis that you may be having.
And because we know that historically in our education that people, only a small percentage of people make a rash decision about suicide. Very often it's a lot of thoughts that lead up to that.
Yes,
it's
sir.
wonderful to be able to have that opportunity, and I appreciate your social worker being so involved in wanting to do that for the community. But you guys do a lot for the community. Let's talk about what other services and options people have over at Terrebonne Health Unit.
So other services that are available at our health unit, we do, my background is in emergency medicine. We used to see a lot of people suffering from sexually transmitted infections, for pregnancy care, pregnancy tests, things like that. But we offer a lot of those services at the health units. We do same-day testing, same-day treatment for a lot of the STIs, sexually transmitted infections, for HIV. We have services available for HIV prevention, what we call pre-exposure prophylaxis, or PrEP for short, and we offer those through televideo services.
Okay.
And as I mentioned, we do pregnancy testing, we do pregnancy counseling, we do all forms of birth control, including IUDs, Nexplanon. We do emergency contraception, which may be even more important with the recent ban on abortions.
Right, right.
We do referrals for sterilizations, vasectomies. Of course, we mentioned the COVID-19 testing, vaccines, monkeypox testing, vaccinations. We do well women exams, including pap smears, referral for mammograms. Other services like vital records, tuberculosis control and treatment. There's a lot.
Right.
There's a lot.
Yep.
I encourage anybody that has any questions, either Friday, go out to the health unit, ask questions, or give us a call anytime.
Yeah, and that again is a all afternoon thing, for multiple hours in the afternoon.
Yes, sir.
And so we appreciate your time so very, very much, and certainly with all the education that we're providing and information. Thank you for joining us today.
Thank you. Thank you for having me.
Absolutely. And that will do it for this particular segment. Don't go anywhere. A lot more local programming here on HTV.